Hello friends, today we'll discuss about anemia. Now, what is anemia? It is decreased oxygen carrying capacity of blood either due to decreased RBC or decreased hemoglobin or both. Cause of anemia is rate of production does not match with the rate of destruction, which results in anemia. It refers to decrease in the RBC count less than 4 millions per cubic millimeter. Decrease in the hemoglobin concentration in adult males less than 13 gram per deciliter. In adult females it is less than 11.5 grams per deciliter. In newborn babies less than 15 gram per deciliter, and after 3 months of age less than 9.5 grams per deciliter. Here also there is decrease in packed cell volume. Grading of anemia depending upon the level of hemoglobin, and the grades are mild anemia when the hemoglobin concentration is 8 to 10 grams per deciliter, moderate anemia when the level is 6 to 8 grams per deciliter, and severe anemia when hemoglobin is below 6 gram per deciliter. Causes of anemia, as we discussed, either due to decreased RBC production or increased RBC destruction or excess loss of blood from the body. Anemia can be classified by two ways. One, that is etiological classification, which is also known as Whitby's classification, and second, that is morphological classification, also known as Winthrop's classification. Starting with etiological or Whitby's classification, that is depending upon the cause. First variety is deficiency anemia, and which include iron deficiency anemia, megaloblastic anemia, which is also known as pernicious anemia when it is due to deficiency of vitamin B12. Megaloblastic anemia also may be due to deficiency of folic acid, and protein and vitamin C deficiency can also lead to anemia. Second variety, that is blood loss anemia, which is also known as hemorrhagic anemia. Acute post-hemorrhagic anemia, the causes are either accidents or postpartum hemorrhage. After delivery of baby, severe hemorrhage results in anemia. Second, that is chronic post-hemorrhagic anemia, which results due to slow loss of blood in case of piles, worm infestation, peptic ulcer, as well as excessive menstruation. Third variety is hemolytic anemias, either hereditary or it is also known as congenital hemolytic anemias. The causes are thalassemia, sickle cell anemia, hereditary spherocytosis, erythroblastosis fetalis or hemolytic disease of newborn, and glucose 6-phosphate dehydrogenase deficiency. Second variety of hemolytic anemia is acquired, which is also known as immunohemolytic anemia, and the causes are direct toxic effects either due to parasitic infection like malaria, snake venom. Toxic effects of drugs and chemical also produces acquired hemolytic anemia, splenomegaly and antigen antibody reaction. Fourth variety, that is aplastic anemia. It occurs due to failure of the bone marrow to produce RBC, and the causes are X-ray radiation, gamma rays radiation, and hypersensitivity to various cytotoxic drugs, sulfur drugs or chemicals. Fifth variety is anemia due to chronic diseases like tuberculosis, chronic infection, malignancies, chronic lung diseases, and chronic renal failure. Second variety of classification, that is morphological, which is also known as Winthrop's classification, which is based on mean corpuscular volume MCV, that is cell size, and mean corpuscular hemoglobin concentration MCHC, that is hemoglobin saturation of RBC. And there are four varieties of anemia. Number one, that is normocytic normochromic anemia. Both MCV, MCH are normal. Macrocytic normochromic anemia, where MCV is increased and MCHC is normal. Macrocytic hypochromic anemia, where MCV is increased and MCHC is reduced, and microcytic hypochromic anemia, in which MCV and MCHC both are reduced. Starting with first, normocytic normochromic anemia. Here MCV is normal, that is 78 to 94 cubic micron, and MCHC is also normal, 30 to 38%, and causes are acute post-hemorrhagic anemia, hemolytic anemias except thalassemia, and aplastic anemia. Second variety, that is microcytic hypochromic anemias, in which MCV is reduced less than 78 cubic micron. MCHC is also reduced less than 30%, and examples are iron deficiency anemia, chronic post-hemorrhagic anemia and thalassemia. Third variety is macrocytic normochromic anemia, in which MCV is increased more than 94 cubic micron and MCHC is normal, that is 30 to 38%, and the examples are pernicious anemia due to deficiency of vitamin B12 as well as due to deficiency of folic acid. Now, general clinical features of anemia. Cause of all this feature, that is anemic hypoxia. When hemoglobin concentration decreases, oxygen carrying capacity of blood is reduced and that results in tissue hypoxia, which is followed by cardiorespiratory compensatory changes. And all the signs and symptoms, they are because of either tissue hypoxia or due to the compensatory mechanisms of hypoxia. Now, general clinical manifestations. Due to muscle hypoxia, there is generalized muscle weakness, tiredness and easy fatigability, pallor of the skin and mucous membrane, buccal and pharyngeal mucous membrane, conjunctiva, lips, earlobes, palm and nail bed, they become pale due to deficiency of red color hemoglobin. Respiratory symptoms, there is breathlessness, along with that increased rate and force of respiration, and it is due to compensatory stimulation of the respiratory centers. Cardiovascular manifestations are palpitation, tachycardia and cardiac murmurs, and this is also due to compensatory mechanisms increasing the cardiac output. And in very severe cases of anemia, there are features of cardiac failure and angina pectoralis. Central nervous system manifestation, they are also because of cerebral hypoxia, and the symptoms are lethargy, headache, lack of concentration, fainting, especially fainting on exertion. The person is having restlessness, tinnitus, confusion, drowsiness, etc. In advanced cases, there is demyelination of white fibers of the spinal cord occurs, which affects dorsal column and lateral columns of the spinal cord, which is known as subacute combined degeneration of the spinal cord. Ocular manifestations of anemia, they are visual disturbances, retinal hemorrhages and cotton wool spots visible on fundus examination. Gastrointestinal symptoms are anorexia, flatulence, nausea, constipation. And in pernicious anemia, there is atrophy of papilla of the tongue. Reproductive symptoms, they are in females, menstrual disturbances, they are present, either amenorrhea or menorrhagia, as well as loss of libido also may be present. In renal system, severe anemia causes disturbances of renal function because of hypoxia to the renal tissue, and also there is albuminuria. Basal metabolic rate is also increased in severe anemia. Now let us discuss various types of anemia, starting with iron deficiency anemia, which is commonest nutritional deficiency anemia, which is more prevalent in developing countries. It is more common in females in the reproductive age, that is between 20 to 45 years, as well as it is also present in the periods of active growth like in the infancy, childhood and adolescence. Now, daily requirement of iron for an adult male, that is 5 to 10 milligrams per day, whereas for an adult female that is about 20 milligrams per day, which is double. Pregnant females, they require 40 milligrams of iron per day. 10% of the dietary iron is absorbed. Now, dietary sources. Non-vegetarian diet including meat, liver, egg, they are the richest sources, whereas in vegetarian diet, green leafy vegetables, whole grains and jaggery are good sources. Animal origin iron, that is better absorbed as compared to plant origin. Which are the causes of iron deficiency? First, that is inadequate or decreased intake, like milk-fed infants, or poor socio-economic status, or anorexia because of any disease. as well as in the elder individuals due to atrophy and poor dentition, decreased food intake. Second cause, that is increased demand. It is seen in infancy, childhood, adolescence, as well as in the menstruating females and in pregnant females. Third cause, that is increased loss, either due to acute hemorrhage, as we have discussed, accidents, or postpartum hemorrhage, chronic hemorrhage like in case of worm infestation, peptic ulcer, menorrhagia and piles. Uterine bleeding in females, either excessive menstruation, repeated miscarriages and postmenopausal bleeding. Fourth cause, that is decreased absorption of iron. Causes are partial or total gastrectomy, achlorhydria and intestinal malabsorption diseases. Characteristic features of iron deficiency, they are koilonychia, that is dry, soft and spoon shaped nails. There is atrophic glossitis, loss of papillae on the tongue, and angular stomatitis, you can see in the figure. Laboratory findings of iron deficiency anemia. Blood picture shows decreased hemoglobin concentration, RBCs are hypochromic microcytic, MCV, MCH and MCHC all are reduced. Bone marrow finding shows marrow cellularity, that is erythroid hyperplasia, erythropoiesis is normoblastic and marrow iron is deficient. And biochemical findings, serum iron is less 50 microgram percentage, normally it should be 60 to 160 microgram percentage. Serum ferritin is also low, which indicates poor tissue storage of iron, and total iron binding capacity is increased, normal, that is 150 to 300 micrograms per deciliter. Treatment, oral administration of ferrous salts as well as correction of causative factor. In severe anemia, parenteral iron is also administered. Another variety of nutritional deficiency anemia, that is megaloblastic anemia, which is characterized by abnormally large cells of erythrocyte series, and it is caused by defective DNA synthesis due to deficiency of vitamin B12 and or folic acid. Vitamin B12 deficiency, the causes are inadequate dietary intake, which is seen in the strict vegetarians as well as breastfed infants. Malabsorption of vitamin B12 is due to failure of secretion of intrinsic factor, which is required for absorption of vitamin B12. Intestinal causes, they are associated with decreased vitamin B12 absorption. They are tropical sprue, ileal resection, Crohn's disease, fish tapeworm infestation and intestinal blind lobe syndrome. Here, Addisonian pernicious anemia, that is due to autoimmune atrophy of the gastric mucosa. And now, because of the autoimmune atrophy, gastric mucosa fail to secrete intrinsic factor, and which results in vitamin B12 deficiency. This is autoimmune disease in which antibodies are produced against intrinsic factor. It is commonly seen in the females of the age group 45 to 65 years. Features of pernicious anemia, anti-intrinsic factor antibodies are present in the serum, and second, that is shielding test, abnormal vitamin B12 absorption test, which is corrected when we add intrinsic factor. So, when we give vitamin B12, it cannot be absorbed, but if we add intrinsic factor, then it can easily be absorbed. As well as other features of megaloblastic anemia, RBCs are large in size and other features are also present. Treatment, intramuscular injection of vitamin B12 is given. Another cause for megaloblastic anemia is folic acid deficiency. Causes for folic acid deficiency, they are inadequate dietary intake in case of poor intake of vegetables. Malabsorption also leads to folic acid deficiency in case of celiac disease, tropical sprue, Crohn's disease. Increased demand in physiological conditions like pregnancy, lactation and infancy. Pathological condition like increased hematopoiesis and malignancy. Certain drugs like anticonvulsants, phenytoin, as well as contraceptive drugs and cytotoxic drugs, they also produce folic acid deficiency. Increased urinary folate loss, that is present in active liver disease and also in the congestive heart failure. Features of folic acid deficiency. Clinical features of megaloblastic anemia are present as well as serum folate level is reduced and red blood cell folate level is also reduced. Now, blood picture includes hemoglobin is decreased, RBCs they are macrocytic and normochromic, MCV and MCH they both are increased, MCHC is normal or decreased in late stages. Peripheral smear shows nucleated RBCs with marked anisocytosis and poikilocytosis. Reticulocyte count is increased to more than 5% and lifespan of this megaloblast is reduced. Bone marrow picture shows megaloblastic hyperplasia, which is characterized by presence of 70% proerythroblast and normoblast. Normally they are 30% and 30% of intermediate and late normoblast. Normally they are 70%. Marrow iron is increased in number and size of iron granules in the erythroid precursor. Both are increased. Biochemical findings: serum bilirubin level is increased due to excessive hemolysis. Urine urobilinogen excretion is also increased due to increased serum bilirubin. Serum iron and ferritin both are increased because iron is not used by this immature red blood cells. Serum vitamin B12 level that is reduced. Normal B12 level is 200 to 900 picogram per ml. Serum folate level is also reduced and RBC folate level is also reduced. RBC folate level that is more reliable indicator for the tissue store. Another variety of anemia, that is hemolytic anemia. It is either due to intracorpuscular defect, means defect in the RBC. Causes are hereditary spherocytosis, sickle cell anemia, thalassemia, erythroblastosis fetalis and G6PD deficiency. Whereas extracorpuscular defect, the causes are antigen antibody reaction, blood transfusion reaction, certain chemicals or drugs. Starting with hereditary spherocytosis, that is inherited as autosomal dominant disorder. Here the RBCs are spherical instead of dumbbell shaped, and etiology or pathology, that is below the cell membrane of RBC there is a contractile layer of lipoprotein spectrin. Normally it is present, and when it is absent the RBCs they become spherocyte. Now when these spherocytes they pass through small capillaries, they can easily be ruptured, and therefore lifespan of the RBC decreases. Instead of 120 days now it becomes 15 to 20 days, and RBCs they are more fragile when they are placed in the hypotonic solution. Here splenomegaly is also present because spleen destroys RBCs, and bilirubin level in the serum is also increased. You can see here this is normal RBC and this is the RBC in the hereditary spherocytosis. Another cause is G6PD deficiency, glucose 6-phosphate dehydrogenase deficiency. Glucose 6-phosphate dehydrogenase is required for the formation of NADPH, and this NADPH maintains glutathione in its reduced state. And when G6PD is deficient, less amount of reduced glutathione is present, and therefore there is damage to the RBC membrane, and which results in hemolytic anemia. Sometimes certain drugs like sulfonamides and certain anti-malarial drugs, they also produce G6PD deficiency in normal individual. Next variety is sickle cell anemia. This is also congenital abnormality. Here there is presence of hemoglobin S. Here in hemoglobin S, what is the pathology? On the 6th position, you can see here 6th position of the beta chain, glutamic acid is replaced by the valine. There, here you can see, and because of this hemoglobin S is produced. And what is the characteristic of hemoglobin S? In case of hypoxia, there is polymerization of hemoglobin S particles and there is formation of long chain, and this long chain gets precipitated and they form sickle cells, and they block small vessels, and that results in infarction in small bones, and therefore it is also known as hand and foot syndrome. You can see here these are the sickled RBC, they block the blood vessel. Another variety of hemolytic anemia is thalassemia, which is also known as Cooley's anemia or Mediterranean anemia. Here there is decreased or absence of synthesis of one or more polypeptide chain in hemoglobin. There are of two varieties, alpha and beta thalassemia. In alpha thalassemia, alpha chain synthesis is decreased or absent, and in beta thalassemia, beta chain synthesis is decreased or absent. And because of that, Again, hemolysis is there, easily rupture of RBC, and it is common in Mediterranean countries, mid-sea countries. You can see here in this diagram. Now, what is thalassemia major and minor? Thalassemia minor means there is reduced synthesis of particular chain, alpha or beta, and thalassemia major, that is absence of synthesis of alpha or beta chain. And now what is the inheritance of thalassemia and how can it be prevented? You can see here, when thalassemia minor subject marries with normal individual, chances of thalassemia minor in their offspring, that is 50%. 50% children, they are thalassemia minor and 50% children are normal. But if two thalassemia minor individual, they marry, chances of children having thalassemia, that is 25% thalassemia major. So thalassemia can be prevented if one of the partner is thalassemia minor. Be sure that other partner must not be thalassemia minor. Another is hemolytic disease of newborn, which is also named as erythroblastosis fetalis. Here mother is Rh negative and the baby is Rh positive. And in the first pregnancy, from the baby, Rh antigen enters in the mother's circulation and mother produces anti-Rh antibodies. Now these anti-Rh antibodies are present in the maternal circulation, and in the second and subsequent pregnancies, these anti-Rh antibodies, they destroy RBCs of the baby, and that results in hemolytic disease of newborn. Depending on the severity, it is named as erythroblastosis fetalis, hydrops fetalis, hemolysis, and the baby is also having jaundice. If it is severe jaundice, it also damages basal ganglia, which is known as Kernick truss. I have already discussed about hemolytic disease of newborn in my blood group video. I am not going in detail. Acquired hemolytic anemia causes are certain drugs like sulfonamides, primaquine produces hemolytic anemia, chemical agents like lead or arsenic, autoantibodies also produces hemolysis, blood transfusion reaction, particularly mismatched blood transfusion produces hemolysis, parasitic infection like malarial parasite, ionizing radiation, and physical damage to the cell by artificial heart valve as well as dialysis produces hemolytic anemia. Another cause for the anemia, that is aplastic anemia. Here there is disorder in the red bone marrow. Aplasia means complete loss of functioning of bone marrow, and hypoplasia is decreased functioning of bone marrow. And the causes are radiation, drugs, toxins, and viral infection. Here there is pancytopenia, means anemia, leukopenia, and thrombocytopenia. All the blood cells, they are reduced. Anemia is normocytic normochromic variety. Another variety of anemia, that is anemia of chronic disorder. Causes are due to non-infectious inflammatory disease like in rheumatoid arthritis. Anemia also is present when there is chronic infection like tuberculosis. In case of chronic renal failure, also there is anemia due to decreased secretion of erythropoietin. And in neoplastic disorder also anemia develops. So this is all about anemia. Thank you.